Untreated mental health conditions during the perinatal period can have a profound adverse impact on women, children and families. And there's a dire need to develop psychological interventions for the treatment of moderate to severe mental health conditions. I developed an acceptance and commitment therapy-based intervention for the treatment of mental health problems in Cardiff and Vale UHB.
We feel the intervention has had a great impact as we provide supervision. As a supervisor, I've personally noticed within supervision sessions, the facilitators have grown their own knowledge and skills in using the ACT model.
What it also showed though was that actually staff had increased psychological flexibility. So that's one of the core aims of ACT. So staff were kind of saying that actually we felt more present. We were kind of engaging with our thoughts and difficult feelings. So our funding has also allowed us to create really equitable and strong partnerships with lots of different sites internationally and nationally. And what that's meant then is that we've had really interesting conversations around how the intervention needed to be culturally adapted to ensure that it did serve the needs of those who were coming to the groups.